This newborn calf was presented with a rare and life-threatening congenital defect. The calf had a severe abdominal hernia along with Atresia ani, meaning the anal opening was completely absent after birth. In today's video, we will demonstrate the successful surgical correction of this complicated condition. On clinical examination, a large congenital hernia was observed involving the abdominal region. The abdominal wall was extremely weak and abdominal content were protruding extremely. Along with hernia, a calf was unable to pass feces because the anal opening had not developed normally. This condition is called Atresia ani, a congenital development defect seen occasionally in newborn calf. During examination, absence of anal opening was confirmed by careful inspection of the perineal region. The calf shows abdominal discomfort and inability to defect after birth. Because the fecal passage was completely obstructed, immediately surgical intervention necessary. At the same time, the congenital hernia increased the extremity of the causes. Abdominal organs were already exposed through the weakened abdominal wall. In complicated congenital defect like this, stabilization of the calf and proper surgical planning are extremely important before process. The calf was restrained properly and the surgical area around the perineal region was cleaned and disinfected thoroughly using antiseptic solution. Local anesthesia was administered carefully around the surgical site. The location of the blind rectal pus was identified by gentle palpation. A careful circle skin incision was made at the normal anatomical location of the anus. The blind rectum was gradually separated and exteriorized carefully. After proper positioning, the rectal mucus